I think that's a good thing to get in. Then it'll be a mindful exam rather than, oh, I don't know what I'm looking at. There's a bunch of stuff in there, you know. So if you get in the habit of, okay, there's the hard palate, the soft palate, the uvula, the tonsils, the teeth.
But we have to say that, I'm sure, during our exam, like during our test.
Yes.
During the test, you want us to say everything that we're looking at.
Yes.
Okay. You think your mouth is clean?
Yeah.
That's the other side of it.
Okay. So you're going to say, hold the tongue with the gauze, and so you can pull it out and look way in the back, because that's the site of many cancers as well. And the other thing is we're going to palpate the Stenson and Morton's ducts and glands. So open your mouth a little bit. The Stenson's duct is in the buccal mucosa, and the opening of it is right near the upper teeth, the molars. So you're going to try to palpate, just see if it's tender or if you can feel anything. Okay? And then lift the tongue up, and you can palpate on each side of that lingular frenulum for the opening of the Wharton's duct. And it should not really be painful, shouldn't really be noticeable.
How does that taste?
Okay. We're going to notice the neck, the anterior neck. Make sure we see if the trachea is in the midline. Notice, have the patient swallow. And notice the rise of the thyroid cartilage, cricoid cartilage, and the midline structures of the thyroid gland, which are the isthmus is here, and the thyroid lobes are out to the side. Then you're going to go around posteriorly and just place your fingers down where the thyroid gland would be, and ask the patient to swallow again, and see if you can feel any thyroid gland tissue. Most of the time you cannot. It's there. If you can feel it, then chances are it's enlarged. Then the last thing is just gently moving the neck through a range of motion to see if it is supple or stiff. If it's stiff or causes any pain, then that needs to be looked into a little more. We're going to look at the lymph nodes by just gently rubbing your fingers, the pads of your fingers, against the skin and feeling for any nodes, any nodules, occipital, postauricular, preauricular, tonsillar, submandibular, mental, submental, posterior cervical, anterior cervical, and then supraclavicular. Can you shrug your shoulders a little bit? Yeah, not quite so much. Yeah. And then you kind of have to dig in there and feel for the supraclavicular. And then go to the side and have the patient bend their head towards you and really get in front of that sternocleidomastoid muscle with your fingertips and see if you can palpate anteriorly any of the lymph nodes in the deep chain. And there aren't any. So I think you passed.
That's not unusual to not
Yeah,
find them.
yeah. Don't keep palpating until you find them, because chances are, if they don't have the infection in their head, ears, throat, there won't be any palpable lymph nodes. Questions?